A wonderful Wednesday. Welcome to everybody. Thank you for joining us. It is 10 a.m. on Wednesday, June 5th. So excited for the conversation we have lined up today. I have just a few introductory slides and then pass it off to our wonderful presenters to lead the conversation from there. But with that, thank you for joining us. This is our fifth session in our year-long intersectional webinar series. My name is Danielle Hubley. I manage our advocacy and education at the Partnership for Strong Communities. The partnership is super excited to be hosting this series. We've been engaging in a wide range of conversations with advocates and leaders in other sectors to talk about the impact that a lack of safe, affordable housing has on their work. Before I get into more information about the partnership and today's topic, I just want to make sure to remind you that this series does take place every Wednesday through October of this year. If you're sad that there isn't a session lined up for November, that's okay because we will be hosting our conference in November. So it'll be fully virtual, fully free. We've got some really great keynotes lined up. And we'll have more information available if you're interested in submitting a proposal for a session. That is also available on our website. So please consider that if you're looking to do that. But enough about the conference. Please join us then. But for now, we're really focused and excited to have this intersectional webinars conversation. Some quick housekeeping before we dive in. Today's session is being recorded, and usually we publish it within the week up to our YouTube channel. So please check out the full series there and also this recording as soon as it's published. And if you have any questions, please use the chat box. It's at the bottom right-hand side of your screen. And just add in your questions. We'll try to get to as many as we can, but we only have an hour and the hour always goes too quickly. So we'll try to get to as many as we can. If we can't, all of the presenters have their contact information listed on their slides. So you can always reach out to folks afterwards if you want to have more of a dialogue. So with that, let me introduce you to the partnership and why we're hosting this series. So the partnership promotes equitable change in Connecticut housing policy by coordinating advocacy, advancing research, and uniting diverse partners. Our vision is that everyone in Connecticut has a safe, stable home that's affordable to them in an equitable community of their choice. And we operate under the lens that housing is a human right. And our mission is carried out through partnerships. We are committed to policies and practices that reduce disparities in housing and within our organization. We ground our works in fact and data to dispel myths, challenge stereotypes, and fill gaps in knowledge to drive change. And we prioritize housing solutions that will be affordable and sustainable long-term, focusing on the full spectrum of housing needs and experiences now and for generations to come. So how do we actualize our vision? We know that a healthy housing system necessitates a comprehensive approach, which intertwines housing affordability, creation, choice, and stability. People need to afford their homes while meeting other basic needs. We need more physical homes, period. We need all different types of homes for people to choose from in all communities across our state. And most importantly, people should have the right to safe, stable homes and should be supported from the experiences of housing instability, eviction, and homelessness. This is how we weave a housing system that prioritizes the needs of our residents and that supports strong families and strong communities. We know that the history of housing in our country is one built on intentional, racially discriminatory policies that have created barriers and challenges for people of color trying to build a healthy, stable life for themselves and their families. Today's conversation is really going to give you a good sense of information that has implications across all four of our priorities. And the presenters are going to be exploring equitable practices and considerations across all elements of our work. So I'm really excited to have them here with us today to share their wisdom and their experiences and the work that they're engaged in. Intersectionality is a framework for conceptualizing a person, group of people, or social problems as affected by a number of influences. It takes into account people's overlapping identities and experiences in order to understand the complexity of the experiences that they face. This series has continued to reinforce the reality that to best support a person's health and well-being, We need to be engaging in holistic advocacy that's addressing people's basic needs and reducing the impact that stress can have on individuals and families. We know that when we aim to achieve housing stability and affordability for all households, everyone benefits. When we protect our most vulnerable residents, our lowest income renters, we build a stronger baseline for the safety and stability of all of our residents. When households have a stable home, they are better able to meet other important basic needs like food, childcare, and healthcare, and are more likely to invest in their community events, services, and local businesses, which we know creates healthier communities and more active local economies. There's so many benefits to housing. And I think that this quote really reinforces, how central housing is to so many different aspects of our lives. It's more than just a physical structure. It's more than just a location for you to be. It is a foundation for a lot of people's livelihoods and success. And quick plug, this quote comes from the book, The Sociology of Housing, and in introductory remarks by Brian McCabe and Ava Rosen, who will be speaking at the conference this year. So you'll have way more opportunities to hear from their wonderful insights this November. But with that said, we also have to think about, in the conversation of intersectionality, its inextricable link to the land that we live and build on. While there is still a lot of work for us to do in addressing our history and the impact it has left on many families, this link is one place you can start to learn a little bit more about the land that you live on and its relationship to our history and the Native peoples who inhabited the land before a lot of us came here. So please definitely check that out and continue to build a relationship in the spaces with our Native partners and allies in the housing work. With that said, now that you know why you're here, and I have taken up some of our time this morning, I'm so excited to introduce you to some wonderful folks from the Connecticut Racial Equity Network to talk more about the intersection of affordable housing and racial equity. And without further ado, I'll pass it off to Bobby to get us started.
Well, hello and good morning, everyone. I'm really excited to dive into this wonderful conversation with you this morning, and where we're going to talk about the intersection of affordable housing and racial equity and forging authentic engagement with people with lived experience. We have a wonderful list of panelists here today that's going to share their expertise, but I would first like to ask our panelists to please introduce themselves. I can start off. My name is Bobby Riddick. I'm the Community Impact and Equity Program Manager with CCHW. And I will be facilitating the conversation today. Anyone want to go next?
Sure, I'll go next. Good morning, everybody. My name is Brennden Colbert. I proudly serve as the training program coordinator down at Advancing Connecticut Together.
Hi, everyone. My name is Precious Edwards, and I am the Health Equity Coordinator for the town of Manchester.
Morning, everyone. I'm a research supervisor at the Youth Action Hub at the Institute for Community Research. I'm also a rapid rehousing assistant at Advancing Connecticut Together.
Hi, my name is Stephanie Letters. I'm the Connecticut Fellow for the Consumer Leadership Project with CSH, and I also work at Reliance Health in.
Okay, great. Thank you, panelists. And we look forward to hearing from all of your great expertise and as we lean into our discussion today. But before we jump into our content and before we jump into our agenda, we thought it was a good idea to share a practice with you all that has been very helpful for me and many of us in our conversations as we lead into Brave Space conversations. It's a practice that, when prioritized at the beginning of every meeting, prioritize at the beginning of every process where you're looking to uplift and embed diversity, equity, inclusion into our conversations. It really helps to, uplift, right, DEI as we really look to evolve our best practices, our policies, and overall systems change. This practice is commonly known as community agreements and also known as community norms, where this practice is a shared commitment where participants in the group practice providing brave and safe spaces for input as we lean into making our policies and best practices more equitable and inclusive. These shared agreements or these shared norms, right, offers a commitment to practice uplifting authentic input, practice transparency, demonstrates inclusion and diversity, and offers a sense of belonging, which is very powerful as we lean into decision-making conversations. There's value in demonstrating how we value individuals' input that we invite to the table and how we use their input as well in these conversations. There's a huge impact when you're knowing that the diverse input is reflective in our best policies, our missions, and is proudly displayed in our halls of our organizations, but also in our mission statements that are posted right on our websites, right? So this practice here that we offer to you all is, a commitment that people can take back, right, in their organizations, hopefully in your conversations as you're leaning into diversity, equity, inclusion conversations. And hopefully it's going to be helpful for you today as we lean into the content, but again, in your future conversations with your providers and with your community leaders. So community agreements can look like, really holding back your knee-jerk reactions to defend, right? And keep a present and an active ear and a listening ear when people are sharing their experiences or offering their input in our decision-making conversations. We are committed to choosing courage over comfort. We are committed to practicing in our fullest ability and to take space and then make space, assume good intent, but also acknowledge impact. Intent versus impact is really huge. Challenge ideas and not people. Brave space. And we agree to stand against aggressions and backlash. We are committed to recognizing the emotional tax, extra labor, and burden that Black and Indigenous people of color, members of our LGBTQ communities, and people with lived experience may face in some of our decision-making conversations. Promote a safe and supportive work environment for individuals of all backgrounds, and to also remember that this is a no judgment zone, right? So that everyone here is working to process right through initial uncomfortable feelings at first, but we're working here to support each other. So hopefully this is, a really a good practice that again could be helpful during our conversation today, but also a practice that you can take back to your organizations and help lead, some of your equitable conversations as you're considering the evolution of your policies and best practices. Okay. So today's agenda. So we are going to go over and do an overview of our CT-REN, who we are in our focus areas. We're going to do an overview of our racial equity terms, and then we're going to dive into our conversation of forging authentic engagement with people with lived experience. So let's dive into getting to know our CT-REN, our equity network. Okay, so an overview for you all, just letting you know our network and really what our purpose is to advance the work of centering equity, race equity in efforts to address housing and homeless disparities in Connecticut, and to provide a platform for partners to share collaboratively develop and coordinate anti-racist policies and procedures that advance racial equity in housing. During our network meetings, we promote, education, transparent communication, collaboration, respect, anti-racist policies, and, how can we help to dismantle discrimination, throughout our state and our organizations, cultural humility and authenticity. Okay, so we will also be putting the link for our network meeting. We meet every other month in the chat, so that we would hope to see you all there to join our conversations. And at this point, I'm going to pass it over to Brennden, who is going to lead our next discussion.
Okay, good morning, everybody. As mentioned before, my name is Brennden Colbert. I am the training program coordinator down at Advancing Connecticut Together, but I also have the unique privilege of being an advisory board member for CT-REN. So I'm here to talk about some DEI terms. If those who don't know, DEI stands for diversity, equity, and inclusion. These terms are specific to affordable housing. I know oftentimes we hear these terms, these acronyms, and sometimes they can feel like they mean the same thing for different spaces, but that is quite the opposite. So let's dive into it. So we'll quickly go over these: affordable housing, Fair Housing Act, inclusive communities, and housing subsidy, excuse me. So just to talk about these pieces of the pie, I was told a couple of days ago that most people have never heard of the term the poor door. Using the reactions, who on this call has heard of the very harmful term the poor door? You know, I didn't think that I was a vampire that was 475 years old, but today I do. So I guess it's a good thing that a lot of people haven't heard of the harmful term, the poor door. The short version of it is we all know, or most of us know, that most new housing developments require a percentage of those units to be affordable housing, affordable to folks who are receiving benefits, so on and so forth. So way back when, to the time of Dracula and myself, mainly in major metropolitan areas, there was a harmful term called the poor door. And when that legislation was passed, landlords and housing managers would require those people who were afforded those low income housing units within this particular housing complex to use a door. It was in the back, it was on the side. Oftentimes they would have to go, down a tunnel just to get up, because the housing company, landlord, whatever terms we choose to use, did not want those people to have access to the same door as the people that were paying full price. So when we talk about affordable housing, when we talk about the Fair Housing Act, housing subsidies, and inclusive, I know it's wild. Now I'm happy that there's a third person living who understands what the poor door is. It's more than just conversation. It's more than just terms that we use. Those folks who are on here who are involved in housing, when you are working on these things, understand that it means something deeper than what you may think. So let's go on. Next slide. One back. Okay. So, also, as we know we've heard DEI for quite some time. It's actually been decades, but it's probably you've heard it the most in the past 5 to 10 years or so. But if you are familiar with that, you're probably familiar that you have been seeing different renditions of DEI, DEIB, JEDI. There's mixed feelings about it. A lot of people feel, and myself included, for full transparency, when folks and agencies and communities remix this term, it kind of can leave a bad taste in your mouth, because like, well, you haven't even mastered or even understood the first rendition of this. So now we're adding things. So I chose to do JEDI because the J added to DEI, which we switch it around, it means JEDI. It stands for justice. And justice is a direct correlation to policy. And regardless of how you feel about politics, you are involved in policy, your community policy, the civic responsibilities that you have as a case manager, program manager, program director, CEO, executive staff, so on and so forth. So let's quickly go through this. J is for justice, obviously, promoting fair treatment and equitable distribution of resources. Keep in mind, equity and equality are two different things, but that is a workshop for another time. Equity is next, providing tailored support specific to that community. You cannot provide the same resources to East Hartford that you can for Avon. Do both communities need resources? Absolutely, but they have to look different. Diversity, embracing and valuing differences in backgrounds, identities, and perspectives. Diverse people are a superpower to any community. I really want everybody to walk away understanding that your diversity is your superpower, and the diversity that your clients bring, that you contribute, all play a huge factor in the betterment of the global community. And last but not least, inclusion. Inclusion is creating an environment where all individuals feel welcome, respected, and valued. When you are mentioning, hey, I have X amount of people who are within BIPOC, or, yep, I started this new venture and 35% of my new tenants are Black, I feel like you're moving away from inclusion. It's one of those things where on paper it looks good, but when you know the exact number of people of color that you have rented to, unless it's some sort of government program, then we're raising our ears like, okay, well, folks should have access to affordable, safe housing regardless of where they come from. So that is a small piece of a very long conversation. Keep it in mind when you're hearing JEDI, when you're hearing DEI, when you're hearing DEIB. I mentioned DEIB a moment ago, and the B stands for belonging, if folks haven't heard that one. That's diversity, equity, and the B is belonging. So yeah, that's what I got. This is probably the shortest time I've ever spoken in my life, aside from my Riverside chats with Dracula, apparently, because I'm the only one who's heard of that before. But thank you all for your time. We'll keep it going and keep those definitions in mind. Last thing I will say is never forget that words matter. That's my piece.
Absolutely. Intent versus impact. Yes. Thank you, Brennden. Okay. Thank you. So our next panelist, we have Precious, who will lead us in our next discussion.
Yes, thank you for everyone who has joined us today to learn about engaging people with lived experience. Earlier, my colleague Brennden had a fantastic slide regarding terms we can use or begin to use or continue to use in stable, affordable housing. And he mentioned, the importance, or it was stated that, fostering inclusive communities is very important. And I think about my conversation with other change makers, leaders, and supervisors in the housing sector, how there's often talk about building the perfect community, right? Creating the environment for people to thrive regardless of their background or socioeconomic status. And I even witnessed this language in my everyday practice, right? When looking at and reviewing and revising mission, vision, values, or you may even have your own personal philosophical framework, right? Where you have a vision for everyone to thrive. That is even the language we use in health equity and the parameters we set to create meaningful policies, programs, and initiatives for this vision of a healthier society. However, when we start having these conversations, and I would say, albeit crucial, and often the first step to systems change on a micro or macro level, we jump far ahead into program policy, initiative conception, and implementation, and forget to center those with lived experiences as that first step. Right. So in local, state, federal government spaces, which is the space I currently operate in, it is a common practice to design a framework. And we probably do this a little bit too much for everything. And the reason for this quote unquote framework is to allow us to remain accountable as we work towards crafting equitable systems to guide our current and future population on a macro level. Now, in the context of people with lived experience, sort of designing an anti-racist framework to center BIPOC and lived expertise will help us build relationships, gain trust, and evaluate best practices to solving our problems. And in this case, affordable housing and homelessness. So as with any anti-racist framework, we must begin at looking at the root causes of inequities that may have led to the issues or problems we are currently looking to address and eventually solve. And we do this by identifying the problem. In this case, the problem can be a lack of affordable housing amidst the housing crisis, increasing rates of homelessness. The problem can be our homeless system's response and even more, right? And so we take that problem and we look at who it affects and how it affects those with lived experiences. And there are many reasons, right? We have historical structural barriers that affects the quality of equitable systems, implicit biases in policy and practices that shape the way we operate. It may be social, economic, and cultural variables that influence equitable access to services. It can be our own lack of understanding of social, cultural, and economic differences. It can be a lack of representation in policies, practices, and people, causing communities of color to be underrepresented in public service spaces and much more. But for the sake of time, we will only address historical inequities as a first step in meaningful engagement with people with lived experience. So here are some of the drivers of inequities in housing that I found, and in everyday practice have been able to identify. Even if they were markers of the past, they still impact communities of color and contribute to the current housing crisis. There's a famous quote by James Baldwin that I regularly refer to, and he mentions that history is not the past, it is the present, and we carry our history with us. And to think otherwise is criminal, right? And so I can look here, we have racial segregation, urban poverty, redlining, racist systemic policies, wealth gap, zoning laws, predatory lending, but there's so much more. And I think about redlining, it was outlawed in the United States, you know, in 1968. And my mom was born in 1968. My mom is still alive today, right? And so even if a policy or systemic inequity was outlawed, that still cannot mean that the legacy is not here, right? And the legacy of redlining continues to have a significant impact on communities of color, contributing to disparities in wealth, disparities in homeownership, and access to quality education and healthcare. And so by acknowledging these difficult truths and the role that we, ourselves, and our organizations that we may represent play in our current climate, we can kind of get a better picture to understand the gaps in our systems on a macro level and create space for a productive and thoughtful dialogue with our colleagues and those with lived experience. And if you identify any other inequities, please feel free to comment.
Hi, yeah, I just wanted to talk about the inequities in housing. I just transitioned out of my position here at Reliance Health, and I was housing individuals, and you know, I found out that during COVID, where there was a lot of money, a lot of empty apartments, it was not easy, but I could house them. Now, after COVID, especially in the big cities like Bridgeport, New Haven, Hartford, gentrification has happened, and the individuals who are low income that I was helping, they were like just unable to find apartments. I had so many individuals in shelters with vouchers that I could not find them apartments. Or the ones that I did get apartments for during COVID, their rent went up above their voucher price, and they ended up, you know, either having to count on family, friends, or housing, whatever. I really believe that, I guess, because I have lived experience, I was homeless, I was in the shelter system, I had a voucher, and it was just much easier when there was, I guess I want to say, landlords who were trying to, you know, buy their own home in Florida. I don't know, because I'm looking at the same apartments that might have been, you know, $700, $800, $900 that are going for double and triple that. And it's very important for people with lived experience, and people that have experience working with the low income population, to get out there and talk to anyone you can to make them aware of the issues that are going on with the housing. Because it's serious. And I can't explain it enough, because I do outreach, and just knowing that you have these families that are working, you know, that can't afford to keep a roof over their head and their family. It's just, I don't know. I'm part of the steering committee for the COC, and that the micro and the macro. So I'm micro and they're macro, and I try to explain to them that something has to be done that even if we come up with something with some subsidies, just to get people housed. Because once you get them housed, the housing first, then you can work on other. But it's such a traumatic event for these individuals that once you try to get them going, I mean, their behavioral health is another thing that I'm talking about because I work in behavioral health. You have to look at the whole picture because once you are homeless or struggling just to pay your rent, you're just surviving. You're not living, you're not thriving, and it affects your children, your life, and in your community.
Thank you. Thank you, Stephanie. Yeah, it's really important, to from the beginning, right, of any strategic plan or, any in decision-making conversations that we ensure that we have, voices, the diverse voices at our tables as we're leaning just to better understand, right, where the disparities are, where are the inequities, and really, uplift, their thoughts and people's thoughts, right, and ideas, right, to how to resolve and overcome, right, those barriers to housing. And that's, a way of practicing inclusion and also creating a sense of belonging, when we're thinking about, updating our policies and our best practices, ensuring that input is captured in the most equitable way. Thank you, Stephanie.
Right. So, Stephanie, you made like a very good point when talking about COVID-19 and how after COVID, it was kind of like this, everything just went downhill. And I think we're seeing that in public health, or it has caused for us to turn inward on the way that we view individuals and their lived experiences. Because the health disparities or the disparities in general were always there, but COVID has kind of exacerbated it, right? And so it kind of forced us to develop mechanisms to acknowledge all of these factors that may contribute to a person's health outcome that are non-medical. And after we've identified the historical inequities that guide the current housing crisis, I feel like the next step, right, in the framework is looking at how it affects people with lived experiences. And in public health, we utilize this concept called the social determinants of health. Who here knows about the social determinants of health? I just want to see if anyone has ever heard this concept before. But it has helped me understand, the factors that influence health outcomes that are shaped by forces beyond an individual's control. And I like to refer to it as this invisible umbrella that we unconsciously hold, right? Brennden mentioned earlier that, we all bring with us, a sort of like a window of diversity, right, that we bring and our clients bring. And I like to think of the social determinants of health as being a part of that diversity, because these are environmental and social factors that impact how healthy we'll be during our entire lifetime. Right. And it shapes where we are today, and it shapes how we interact with the world. And, these outcomes are predetermined for us based on our environment and other characteristics we cannot control. And the social determinants of health has more impact on your health and your overall health outcome than your own genetic makeup, which is mind-blowing to me when I first started learning about it, because I would never think, that my everyday life and the way that systems have been created influences how healthy I'll be, when I'm, later down the line in 30, 40 years. These factors are also interconnected, right? So your zip code or your neighborhood impacts your opportunity to access quality schools, adequate healthcare, social amenities, libraries, and opportunities for employment with fair wages. There are also certain physical characteristics that under-resourced neighborhoods share, like few open spaces for play, right? Parks, green spaces, pools, urban blight, lack of affordable quality housing, less access to public transportation, less access to nutritious foods, right? We've heard of food insecurity. We've heard of food deserts being prevalent and prominent in under-resourced neighborhoods. And so, that also leads into lower income neighborhoods being heavily policed as well. And I strategically placed housing at the top of this graphic because it is a major social determinant of health. And if we want to improve health outcomes, we have to incorporate people with lived experience, right? Because they will allow us to get a glimpse of all of these nuanced factors that can tailor our programs, policies, and organizational culture to be a more inclusive community and environment. And like Brennden said, regardless of where you are, where you stand, you have a place somewhere within the social determinants of health, right? We all work for organizations or maybe an institution that may impact someone's ability to gain access to housing, that may impact somebody's access to affordable quality healthcare. We may develop programs that provide nutritious foods, or maybe we have a nutritious food program that may allow an individual to gain access to quality nutritious foods. And so you fall somewhere within the social determinants of health that shapes an individual's outcome.
Yeah, I just wanted to comment on the now, since wages are higher, a lot of families that were on HUD-CB, now they're on spend downs, and it's really difficult for them to bring their children to the doctor because either they're on a spend down or they have to get their insurance through their job or the marketplace, and it's really something they can't afford, and so then now you're looking at, can I pay my rent? Can I get, Joey his antibiotics, this, that, and the other. I mean, it's I keep saying it's really traumatic. When you're dealing with a family that's trying to take care of their children, every one of these should be up in neon lights because they're having issues.
I just wanted to quickly add to when I think about society and institutions or access to affordable healthcare, I think about the fact that LGBTQ plus individuals have 2 times more likely to experience early death, and trans folks have 4 times more likelihood to experience early death as well. So I think that feels like a social determinant for me. If just because your gender identity or your sexual orientation, you are more likely to die in early age is insane to me.
Yeah, thank you for your input. And I think, Precious, you also, really kind of helped, with really, and Brennden as well, with saying, we all fit somewhere, right, in this diagram here. And what steps can we take? What impact can we have, to help sustain or help to improve, right, someone's quality, right, or housing stability. We all play a role, right, in our community. And it's really, identifying, where we are and coming together through an inclusive and diverse process to determine, what could be the next steps, to help improve, our community. Yeah. Thank you. Okay. Is there any additional input that any of our panelists would like to add to this slide before we move to the next slide?
So we know that housing quality, and homelessness impacts outcomes. And these factors can tailor our policies, systems, and scope of care to dismantle inequities. So just take a second to look at some of these factors and, put in the comments if you identify any additional outcomes that inadequate housing or homelessness negatively impacts. And I think when we are serving our clients and when we are a community with each other, it's so important, especially in the context of DEI, to do that, archaeological.
Okay, did Precious freeze? Okay. Okay. Well, she'll come back online, definitely. Okay. So I believe, and I can try to, try to jump in a little bit for Precious, just really looking at, the housing and housing quality and and homeless impacts, and knowing these factors can tailor our policies and our systems and the scope of care, right? So kind of looking at, really what is the impacts of housing insecurity, right? And really like, what can we do to help? Where can we, have a next call to action? Where can we leverage, and offer our expertise, right, to help, uplift our community, right, and help to dismantle inequities, right? And on an ongoing basis, what is the process of, connecting with your community and really seeing, like engaging, like how are there more disparities that people are highlighting, or there are more, impacts of housing insecurity? How are we making sure that we're collecting this information? And again, being transparent with how we use this input, and really, demonstrating, that inclusion with, developing strategies to address, or to minimize the impacts. Okay. Would any other panelists like to add to this slide?
I would definitely like to just like hone in on like social exclusion and also around education, just talking about like all of the compounding factors of, one of the biggest things impacted when you're experiencing housing instability and homelessness is like kind of this destruction of your entire social network, friends, family, people to rely on. That is so many resources to have a community, and to have it slowly being taken away because of being in poverty, being housing instability, etc. And so just losing all those people, and then the aftermath, if you are able to find stable housing, is rebuilding that social network while also trying to find gainful employment as well, because we know that's the only real way to afford a lot of things, is to find gainful employment. And it's so difficult when you're not able to focus in on your education, focus on bettering yourself, or just improving your livelihood in general. You don't have any social supports because they've gone away over time. And so those are the things that I think about when I've had conversations, especially with young people. It's just the lack of life skills people come into housing instability with, and how it just makes things worse. Everything becomes harder the longer that you are experiencing homelessness. So just wanted to highlight that. And I definitely saw criminalization inside the chat, and just wanted to highlight that from Kelsey. Thank you.
Yeah, absolutely. And also in the chat, I think it was also mentioned that, sometimes people in our libraries, right, see a lot of people who are experiencing homelessness, or, that are there, that may be also battling, with mental health, and it's really kind of coming together with, for one, identifying, right, what community providers are around you, right? And how can you forge relationships with those community providers, whether it is a mental health provider, a community action agency, or, senior centers, right? Or faith-based organizations, and identifying what resources are available in the community to help connect people to, and sometimes when it comes to, police engagement as well, like what can we do to engage our local police departments, to get them involved, right, on a positive way? Where can we involve, right, and local law enforcement in our, community or regional meetings, where we're having strategic, inclusive and diverse conversations about the inequities that we're seeing, and we're developing strategies to uplift our community. So, and really embedding, right, that practice into our day-to-day, into our work, into our systematic work, and not just, one-on-one relationships, right, with providers in the communities, but how do we embed that communal work and communal ongoing relationships into our organizations, into our networks, into our communities? Yeah.
Thank you, Bobby.
Yeah,
what
sure.
better what better thing in time to lose Wi-Fi? But yeah, I can also say that this will also allow for change makers and leaders when we begin to engage people with lived experience to start anticipating, these outcomes, right? And that will allow us to, develop better language and have a more authentic engagement and collaboration with people with lived experience. Okay, so this slide is basically just from what I had mentioned previously, to understand where we stand within the social determinants of health, and just acknowledging our role and understanding how we can, or where we can intersect within, an individual's life, to sort of operationalize the way that we include them in those crucial conversations. So, for society and institutions, right, acknowledging the role that we play, as individuals who represent organizations within the social determinants of health, providing a platform for social inclusion and non-discrimination, right? So having an existing framework for DEI and or in the process of operationalizing DEI or health equity or racial equity in your workplace culture will kind of give you a head start on developing the language to be able to include people with lived experiences in those crucial conversations, anticipating barriers to participation, right? As we mentioned earlier, there are a variable amount of outcomes, right, that can lead to health disparities that an individual may be facing. And that's kind of like the weathering the storm and the allostatic load, right? So just be careful to, be cognizant of transportation, technology, childcare, and an individual's work schedule when we are including them in our processes. And then also, consider incentivizing people with lived experiences for their time and contributions, and also serve as a bridge between services while including people with lived experience in crucial conversations, right? Provide transportation, right? Make sure we are expecting, or not expecting, but we are anticipating technology barriers, right? We may want to host sessions in person. We may want to have sessions that are outside of the traditional work hours, right? To make sure that they feel included.
Yeah, I can comment on this. Thank you, Precious. With the CLIP project, the Consumer Leadership Involvement Project that I'm part of. We had a couple individuals that we supplied them with technology, and they were living in their car. Sometimes you gotta meet them where they're at. I will tell you, those two individuals had so much insight because they were in the system going through it, and we needed their feedback, their suggestions on how we should change policy. And another thing is also I can't emphasize more is paying the people with this. Okay. A lot of people want them on their boards and board committees and stuff. But I mean, this is they're using their experience. Their experience it's their skill. So we have to pay them for their skills, and that definitely compensate them for this.
Thank you, Stephanie. And I also saw in the chat, I don't know if your name is also Stephanie Clark. I really appreciate you for adding that the expertise that people bring to the table. Like Stephanie was saying, like it's not just your lived experience, it's the skills that you're bringing, it's the knowledge that you have that's so valuable. And honestly, it's like such a hot commodity in these spaces. A lot of people want your advice, want your thoughts, want to include you in different spaces. And I was one of the people who helped with creating these slides, and I kind of feel bad saying this, but I hate the word consider incentivizing now that I think about it, because the reality is we're asking people to sit at tables that people are getting salaries for. We're asking people, we're young people or people in general with different lived expertise to contribute to creating programs. Like we are essentially just asking people to do our jobs, and then we are paying them either not equitably enough or we're not paying them at all. And in my experience with the Youth Action Hub, like I've seen so many different advisory boards, so many different research surveys where people are being paid in pizza. And so it's a practice that I don't see as often anymore, but it's something that I want to acknowledge is that we can't ask people with expertise, people who've had all these different experiences to join into these traumatizing conversations, to be our consultants, to design our programs, to give us feedback on everything that's going on while they're still experiencing housing instability, while they are not getting their basic needs met, and not at least pay them for giving us their time and adding this to their busy, chaotic schedules. And so I really appreciate this slide a lot because I often hear that, you know, we try to engage people with lived expertise and they just don't want to, or we just can't get them to the table, or they're just not interested. And like a lot of this is just not having the proper preparation, like thinking about like if you're asking someone to join a meeting or join a board consistently, like if you were experiencing housing instability, if you were hungry, if you didn't have access to a computer, would you be in this room, in this space right now? And these are the questions that we don't consider oftentimes when inviting people to these spaces who are, you know, are currently going through it. And so before you even invite someone with lived expertise, think about what kind of impact you want to have, not only on whatever program you're designing, but on that individual themselves. How are you helping them to be in this space? How are you helping them meet their basic needs and keep them as an ongoing partner? You know, we have, you know, I know so many people in this space for the last 8 years, ever since I was 16 years old, being a person with lived expertise experience. And that's because everyone in these rooms have chosen to continue engaging in a partnership. You know, I have 8 years of experience now in this work because people have found different ways to fund my position or make sure that I'm here. And so we have plenty of young partners, but also older adult partners with lived expertise in this work. And we have to make sure that we continue to not only engage them, but make sure that we're meeting the needs that they are at, you know? And so that's just one thing that I want everyone to think about, and making sure that there are roles for people that are not just speaking to like everything. Like I can't represent every single young person's homeless experience, and that is why I'm also a researcher. I use the research work, the conversations that I have with many young people every single day to help add to the conversation. I can't just speak from Angel's experiences, and if I did all the time, I would be exhausted and I wouldn't want to be a part of this work, because it sucks to always think about my own experiences and how that contributes to the work. I want to be a part of something larger and use my lens, but I also want to give everyone else a place where they can speak from as well. So I will stop talking now and add more to the next slide.
Yeah, no, that was great. Thank you so much. And can I add, you know, is there a process of maybe hiring, right? Can we hire voices with lived experience as well? And to bring them, you know, to bring people just to make sure that our teams are diverse and inclusive, something to consider. So yes, last slide. Yes.
Yeah, so I know we're running on time, so I'll just quickly introduce the slide. But I mentioned earlier that in government spaces, we tend to create a framework for everything. And this is actually, a framework that I found that identified roles for people with lived experience, right? To make sure that we continue to have meaningful interactions and authentic engagement. And so it's split into 4 categories. Community members, they can serve as community members through listening sessions, public testimonies, interviews, focus groups, and digital storytelling. You can have people with lived experience in an advisor role, right? On committees, groups, on boards as trusted community members. Partners, right? Collaborating with individuals with lived experience through consultation, right? So paying them for their time. Technical assistance and trainings for your staff. And we can hire them. Hire people with lived experience who bring valuable expertise and perspective to their work and or role.
I'll add a little bit to this slide as well. Like I was saying before, like I am a staff member at the Institute for Community Research. I've been staff there since I was 16. So since the very beginning, I'm not just an advisor, I'm not just a community member, which those are amazing roles as well. I just love the idea of employing people with expertise, creating opportunities for them to continue in this field and continue in this work. So many people that I know have been engaged in different ways and want full-time positions in this work. And, this work isn't easy. It definitely can be exhausting at times, and there's so much that we deal with. And so the fact that we are working with people who have gone through such traumatic experiences and they want to stay working in this field, I think is amazing. And I think it's unfortunate that we don't have the opportunities most times to continue engaging these folks. And so I think that, identifying different ways that we can work with people and thinking about the long term when you're thinking about your community members or your advisors, when they're interested in becoming a part of the organization, like how do we create that? And so I'm happy to have those conversations with people. I do this I'm happy I do this work. We have resources at the Youth Action Hub for partnering and hiring folks, or at least just identifying roles and making sure that people aren't just sitting there just confused of how to contribute. There's so many different ways to be a partner as a person with expertise.
Mm-hmm. Yeah. Yes. So thank you. Thank you so much ever grateful to all of our panelists who gave and offered, your expertise and really engaged, hopefully empowered the community and participants to continue these conversations after today, bring them back to your community, bring them back to your organization, and through, again, a diverse and inclusive process, really start, laying out, right, well, how can we advance, our work to operationalize diversity, equity, inclusion in every space that we're having conversations and decision-making conversations. Thank you. We all have listed here our contact information. If you have any future questions or any future feedback, we appreciate you. And hopefully I'll see you soon and more to come.
You all so much. We'll leave this slide open for a moment. And just a reminder, this series takes place every Wednesday, the first Wednesday of every month. Next month, we're talking about the intersection of affordable housing and civic engagement, just in time for the upcoming election season. So thank you all so much for joining us. We so appreciate your time and can't wait to see you in future conversations.